There are two bony landmarks in the cervical spine, C2 and C7. Flex your patient's head forward so it's resting in the palm of your hand. That will relax the muscles down a little bit. Palpate down the back of the head until you feel the first bony prominence right around the hairline of your patient. That should be C2. You can rock the head back and forth a little bit just to feel the stationary bone beneath your finger, just to confirm. For C7, palpate what you feel is the largest protruding bone in the lower part of the neck. That should be C7. Most of the time it is. It's called the vertebral prominence. To confirm it, place your fingertip in between the spinous process of C7 and C6 and extend your patient's head backwards. You should feel C6 spinous process glide away from your finger. If it does, you'll know you are on C7. Once you understand where and how to find C2 and C7, you can palpate each of the other spinous processes in between. They are one fingertip distance down from C2. Again, rock the head back and forward to feel the small bony prominence beneath your finger. These are kind of difficult, so it'll take some practice. Palpate the soft tissue structures as well. Flex your patient's head forward, resting in the palm of your hand, and feel each side of the spinous processes along the musculature of the neck. And all you're doing here is comparing side to side to see if there's symmetry. If you feel an area where there may be some kind of muscle tightness or spasm, go ahead and push on it and ask your patient if it's tender. That usually indicates some area of potential misalignment. When you're done, make sure your patient's head is in an upright position and palpate down the spine along the spinous processes to see if there's any tenderness. Tenderness many times indicates the spine is misaligned in that area. Lastly, palpate the shoulder muscles, the trapezius. The trapezius muscle works its way all the way up the neck and inserts itself in the base of the occiput or the skull. So you're just taking your flat fingers and going side to side, again, feeling for symmetry and noting any areas where the muscles may be tighter on one side as opposed to the other. Again, ask your patient for tenderness.